Hello, congratulations. My name is Mona Hanna-Attisha. I'm a pediatrician with Michigan State University and Hurley Children's Hospital in Flint, Michigan. I'm so excited to be here with you, albeit virtually, but I got my cap and gown out, and I'm just really thrilled to be celebrating this occasion with all of you. So I was the pediatrician that helped uncover the Flint Water Crisis, and since then I have been working on our long-term recovery. By now, most of you know the story of Flint. It's probably the story of one of the most emblematic environmental and public health crises of our time. It's a story of what happens when the people charged with keeping us healthy and safe care more about money and power than they do about us. It is a story of a health injustice. And as much as the story of Flint is a story of a crime committed with absolute indifference against some of the most vulnerable people in our country, it's also a story of how everyday people, moms and pastors and activists and journalists and scientists and students and doctors, people just like you and me, came together and said, we've had enough, and fought back. It's a story of academics and health professionals of all disciplines walking out of our comfort zones, out of our hospitals and clinics and classrooms and institutions, and into the community, working hand in hand in humble partnership to challenge the status quo. The story of Flint is a testament to the idea that individuals working together from all walks of life and all disciplines can absolutely make a difference. And in some ways, the Flint story is really a playbook of resistance and hope. And that is a story that we all need right now. And that's what I want to share with you today. Because the story of Flint is not isolated. There are communities everywhere, from the Rust Belt to rural America to coal country and beyond, black, brown, white, all of us, many of us, that wake up to some of the same disparities, the same nightmares of poverty, injustice, lost democracy, and stolen opportunity. This is all happening now, and this all impacts the health of our communities, filling our hospital beds, dropping life expectancies, and deteriorating our public's health. And this is where we need you. Your work is about joining us, all of us. It's about standing on the front lines every single day, holding those lines against sickness and disease, and also holding those lines against inaction and apathy. Today, in light of the pandemic, which has exposed so many of our underlying health injustices, this is especially critical because our collective work is unfinished and quite possibly more important than it ever was before. Reverend Martin Luther King Jr. said, "Of all the forms of inequality, injustice in health is the most shocking and inhuman. Our communities cannot afford to have the guardians of medicine and health, and that's all of you, shut their eyes, look away, and stay silent to injustices that threaten their health. The integrity, vision, science, and activism of the healthcare workforce is imperative to fix these critical problems of today. I urge you, all of you, to use the tools that you learned in school and the tools that you will continue to acquire, because this is all about lifelong learning, to keep your eyes open. I urge you because I believe in you. I believe in every single one of you. Let your clarity of vision and your broad health perspective show you the world as it should be, not the imperfect place that it is. From this day on, you are all entrusted to be the voice of health, and we are all depending on you. And when we do all come together in our many different voices, from our many different disciplines, from all around this nation, we can each be a piece of the answer. We can each work to solve the many problems all around us, just as we did in Flint. So let us work together towards that healthy America. Congratulations. I am so excited to call all of you my colleagues. We need you. Thank you.